As a nurse of over 35 years, I am greatly concerned. I work in the healthcare field right here in the Washington, D.C. area, and I'm seeing a trend that I want to bring to the attention of my fellow Black Americans, Black Caribbean folks, Blacks of any kind or shape, wherever you come from, that I think you all need to be aware of. That is, for folks who are showing symptoms of COVID 19, our symptoms as Blacks are different. You don't have a cough, you don't have a temperature, yet our folks are dying at a higher rate than any other nationality or group. And that is because instead of a fever and a cough, what our folks are showing up with is what we in healthcare call malaise, or you just don't feel right. And on top of that, what happens is you start having either pain in an extremity or you just start feeling a little winded. Guess what? If this is happening to you, you need not to go lay down. The clock is ticking. This coronavirus brings on bleeding inside our bodies, whether it's in our extremities, in our hearts, or in our lungs, causing blood clots. And that's what's killing our Black folks. Now, if you can't get to a doctor, then you need to get up and walk. You need to start taking deep breaths as much as possible. Use some of your old home remedies. You know how your granny used to give you the garlic and the lemon and the ginger? Make yourself a poultice of onions. Put it on your chest. But it's by time that we start doing something for ourselves. We are losing our Black males, especially, faster than the doctors and the lawyers can pick them up. And the reason for that is one of the symptoms that is very common among our Black men is pain in the muscles. And guys, no pun intended, most men, when they start to have a pain of any kind, wants to lay down. This is not the time to lay down. If you lay down, your lungs is filling with blood. And when that blood starts clotting, you can no longer pass oxygen to your bloodstream. So I'm no major doctor, but I've seen too many die in the last couple of weeks like this. And if you really start thinking, you go back as far as February, where we started finding people in their beds dead. And it really seems like it's that virus that was already in our community.
What's your take on your initial thoughts on what this lady was just?
Well,
Because her, just to give you a background, she manages a retirement home, basically.
mm-hmm.
So when she talks about seeing people in the beds dead, that's sort of the situation.
All right. So several things that she says in the video, and this is her opinion about it. I would like to address one when she said a lot of Black people are dying, Black and Hispanic are dying than other. Did she say than other races? I don't.
Well, she just emphasized, it seems like
More
people of
color.
yes, are
People of color dying. I believe that people of color are more so affected by the virus. When I say people of color, I'm gonna specifically going to focus on New York because I don't know what the numbers are in other states, and I work in New York, so I can make a conversation about that. If you look at the communities in New York, especially in Brooklyn or Bronx or Queens, majority of the persons who work as essential workers are Black. A majority of the person, and when I say essential workers, also I'm talking about the transit workers, the bus drivers, the persons who work in the supermarkets. These are Black and Hispanic persons. These are people who can't manage to stay at home to feed their families. So these individuals have to go out and have to work. And by doing so, they're being exposed. A lot of these stores are that are open, Target, these Whole Foods, majority of these individuals are Black. So a lot of these, what's happening in our Black community is resulting from the essential or for healthcare, not healthcare workers, essential workers. Another reason why the Black community is affected mostly is because we're not taking this very serious. I posted a video, I believe it was on Sunday, with over 1,000 persons in a barbershop in Canarsie who's having a party. Over 1,000. And I mean, you can't talk about the effect without what's causing the effect. Um, Another thing that I want to point out is we're not taking it serious in a sense. When I was in Jamaica, a family member of mine, which I'll remain nameless, said to me, "Oh, Black persons are not being affected by this virus."
Yeah.
And this person is very intelligent,
Yeah.
a very intelligent family member of mine. And I said to him, "What do you mean? I've never heard anything." "Oh no, because they're saying her genetic makeup and the BCG vaccine and a whole bunch of other stuff," he said to me. And I said to him, "I don't know anything about that."
Yeah.
I said, Blacks and white, all have anatomically, we have the same makeup. A man have a heart, a woman have I said the only difference between a man and a woman internally is their reproductive organs. Everything else is pretty much the same.
Mm-hmm.
So how is this virus gonna discriminate against a particular race or culture and skipped over Blacks? So I think in the beginning, when all this started, we as a people, we were not taking it very seriously.
Sure.
And she's talking from her standpoint of what she's seen in a retirement home, of dealing or caring rather for these elderly folks. When she stay malaise, that's the feeling of being tired. I had a lawyer who came through my ED, no symptoms. The only symptoms she had was syncope, fainting.
Mm-hmm.
They did all her workup, blood work, test her creatinine, anything, no signs of dehydration because we thought that's possible reason why she kept fainting.
Mm-hmm.
Everything we did, EKG, everything was normal. Then the doctors decided to do a COVID-19 test and she came back positive. Wow. So there's a lot of different symptoms, as she said in the video, where persons are exhibiting differently. Mm. Some people will feel malaise, as she said, being tired. But I wouldn't specifically characterize it only to Blacks. I believe that it depends on how you take care of your body. How are you those individual who takes your multivitamin or what have you? How was your health regimen prior to getting ill? Right. Of course, if you're someone who is on top of your health, you may present with less severe symptoms than someone who is not who does not cooperate, or someone who is not like say eating healthy, or not even eating healthy, but persons who are not adhering to their medication regimen. So to answer your question, I do believe that Black and Hispanic persons are being affected more by this virus because of the professions that we are in, or because of our financial or socioeconomic status, and that's always been until for the beginning of time, you know. Um,
Unfortunately.
huh?
Unfortunately.
Unfortunately.
Yeah.
Um, for me, I could have taken a leave of absence, or I could have quit my job and say, I'm not going to deal with this. I have savings and I have a partner who's still working from home. But I chose to continue in the profession that I love, regardless of the risks and consequences or exposure that comes with. A lot of person of color do not have, can't make that decision. You know, I don't see if you, well, you're probably not on my Instagram, but there's a post that I made a few weeks ago where I have a crying baby holding on to a mother,
Mhm.
and I have the virus outside. So how are you going to decide? Are you going to um, go out to work, which you have to, or are you going to stay home with your hungry child?
Mm.
And probably is going to die from malnutrition or whatever. One of the things that I and my husband have been doing is we're still um, paying our
Babysitter.
we don't have a babysitter because Amir Amir is in nursery school, but we have a housekeeper, so we still paying her. You
Mm.
know, and she's Hispanic, and I'm pretty sure that's how she makes her living and support her family. And that's a decision that we make together to continue payment to her.
Yeah.
You know, and I post, when I post that photo, I said to persons who, if you're in the position to help or to continue paying these individuals that you employ, whether it's a babysitter, a housekeeper, whatever,
Yeah.
that's relying on your source of income while you still have your source of income, you know, you should do it. So in her video, yes, she made a lot of valid points. The natural remedies, as you know, garlic, ginger, those are anti-inflammatory agents that helps with our breathing. And garlic has been around forever, and honey, you know, garlic, honey, ginger, turmeric. Those things also have bronchodilator responses in terms of helping you breathe better, dilating the lungs, and all that stuff. The position that we are using mostly in the hospital now with our COVID patients is the prone position, which is when you lie on your stomach. Supine is normally on your back. So when you're lying on your back, it's not only preventing, it's preventing a lot of pressure, because everything is, remember, your lungs is also is in the back. So when you're lying on your back, you're putting a lot of weight and pressure on the lungs, and especially with COVID, most of the times come with pneumonia. So your lungs is already heavy from all the fluid. So you're putting that extra pressure on it. It's gonna make it harder for you to breathe. So what we do with most patients when their oxygen levels start to desaturate is we prone them, we put them on their stomach, and you would see an increase in their respiration and their oxygen. So that's true.
Okay. I was just curious if that was like another, conspiracy.
No, that's a practice that we have been doing now. And also if you have someone who could do some chest PT, just patting on the back, patting on the chest, just to help break up the fluid and help to expand the lungs. And so, yeah.
Is there like a particular breathing technique that you can next do to?
Well, we encourage to take deep breaths.
Is
You
there a length of time you have to do it for? Or?
normally for like a minute, or if you have an incentive parameter, we encourage our patients also to use incentive parameter.
What is
That
that?
So it's a device.
Okay, so here's the thing. I'm the reason I'm asking these questions is I'm saying if you have folks that are self-quarantining, right? So they
Mhm.
don't have access to a nurse and to all these gadgets.
Just regular breathing exercises. Take deep breaths. This helps to re-expand your lungs, and help you in terms of how much oxygen you're able to circulate throughout your body. I'm just trying to say it in layman's
Yeah.
terms. Yeah. So just take deep breaths,
Mm-hmm.
hold it, let it out, continue doing that. However, if you're taking deep breaths and you're starting to feel any pain, whether in your back or in your chest, then you need to contact 911 or the doctor.
Okay. Jadora, thank you so much for your time, your insights, helping us to get some form of grip or understanding, a better understanding from someone that's on the ground. Thank you so much for your time.
You're welcome. Stay safe and be well.
You too.